Hi guys! On this video, we're going to talk about our second type of research methodology called the before and after method. So if you haven't watched the previous 3.1 video on the after the fact or the ex post facto method, make sure you go back and watch that one before watching this one because this will make a lot more sense. Okay. So just like the name implies, the before and after method is examining a phenomenon or an outcome before something happens and after that thing happens. And in terms of evidence, it provides us better evidence of a causal relationship between our two variables. All right, so when we think independent variable, and does that have an effect on our dependent variable, the before and after method can give us a much better idea than just the after the fact method. And the reason is because we can observe our dependent variable before any sort of cause, influencer, or predictor affects it. So it's kind of like looking at something before you introduce that variable and then examining it afterwards. And I'm going to go through a few examples in this lecture. So this is really good to use if we have a question that we can start with like, I wonder what will happen if. I wonder what will happen if I don't put gas in my car and I'm on yellow and I try to make it all the way home. Will I run out of gas? Will I not? Or I wonder what will happen to my headache if I take some paracetamol. Will it get better after that? Now, it's not just called the before and after method, so you might not see that in your textbook. What you might see it called is the test-retest method or the pre- and post-test method or model, okay? It's all referring to the same thing. And how do we draw it out diagrammatically? Well, as you can see below, we still have our X's and O's, but we've added one before that initial X. So we have a measure of our dependent variable or our outcome. Then we introduce the X, which in this case would be our cause, our predictor, or our influencer. And then we measure our dependent variable again. So as you can see on this graph, we've got an O1. So that's a measure of the dependent variable at time 1. And we've got an O2, a measure of the dependent variable at time 2. So that's why we can sometimes call it the pre and post test or the test and retest, because we're getting two measurements of our dependent variable. Let's use an example about pharmacology, okay? A psychiatrist might be enrolled in a study looking at a new drug, and he's going to give it to his own patients in order to get some data on if this drug is effective or not. So he calls patients into his office, and at time 1, all his patients meet criteria for depression. And he rates them on a scale, each person individually, on a scale from 1 to 5. Okay? So all patients at time 1 have met criteria for depression, and they're scaled on a 1 to 5 scale. Then he gives each patient in the study the new drug treatment. 1 tablet a day, every day for 6 weeks, okay? And in our model here, that's the X1. That's our independent variable. So this is what the psychiatrist is hoping will cause a change in the dependent variable or will cause a change in their depression. Now, in order to ensure that they take their drugs and they all have the same environments, the same diet, the same kind of care, he puts them all into a hospital setting. So what's that essentially doing is controlling all these other outside variables that might affect depression rates, not being the independent variable, okay? So by controlling for those variables, he's really making sure that if we do see a change, we can really attribute it to our independent variable, which in this situation would be the new drug treatment. After 6 weeks, the doctor reevaluates the patients, and he rates their depression again on a scale of 1 to 5, the same sort of clinical criteria as he did in the first place. He concludes 75% of patients have improved. And that means moving up or down the scale in terms of depression. And that looks like a pretty big effect, doesn't it? 75% of patients who took this new drug treatment saw a decrease in their depression symptoms, or in simple words, they felt better. Okay? So we took a measurement of our dependent variable, depression, at time 1, then instituted our independent variable, the drug treatment, and then took a measure of that dependent variable again. And by comparing O1 and O2, we can see the change in our dependent variable, okay? By using the after the fact method, we can't see that change. So therefore, we have a lot more control and a lot more certainty using this model that the independent variable did have an effect. So, thinking about the before and after method, there are some threats to how certain we are about if our independent variable has an effect or not, and we will talk about this when we get to a lecture on validity. Now, how can we make sure that this is a really valid and accurate way to test if an independent variable has an effect on the dependent variable? Well, we call these things the 4 rogues, and these are what are our threats to validity. Again, we're going to cover this in a subsequent lecture. But what we can ensure is that we have stable observations. We repeat our testing, so it wouldn't be a fluke. If we found the same results over one or over more than one period, we can assure, okay, yeah, I'm feeling pretty certain that independent variable did cause that effect. We can use quick acting treatments. So if somebody has a headache and we give them a pill and say, yeah, it might not help your headache for about 3 weeks. Well, if the person still has a headache at the end of 3 weeks, then we can't be sure that medication did anything at all. We can eliminate any stray suspects, which means we can control for outside variables. And that's why having control variables is really important to our research. And finally, we can do our best to ensure that research participants are not aware that they're getting a treatment, or that because they know they're in a study, their behaviors will be influenced in one way or another. We'll talk about this as we go on and talk about how sometimes working with human beings is really tricky, okay? Now, when we talk about providing a stable baseline of observations, this is what we mean. Let's say you have an allergic reaction. So you might be allergic to strawberries, and you're helping some researchers look at an anti-rash medication, okay? So you will report at time 1 for the O1, the first measure of your dependent variable, which is the presence of a rash. And then they'll follow you every day after that, or every hour, however long you want to space out the times between observations. And these X's up here would be doing nothing. So this is just saying, okay, we're watching you. We're going to take an observation again in an hour. Yep, rash is still there. Keep going. We take another observation in an hour. Rash is still there. Great. So we know that it's a stable observation. It wasn't just a fluke. And then finally, right about here, we introduce our IV. So in this case, it might be our experimental anti-rash medication. Put the ointment on your skin. Another observation done. There's no rash. So can we conclude that the independent variable had an effect on the dependent variable? Yes, we can. But how about we take that even further? Let's repeat the testing. If we stop using the ointment, or if we take the IV away, do we see a change in our dependent variable? And then if we reintroduce the IV, just like we did in the last test, will we see the change again? So this would be demonstrating that effect there. We don't have any rash after we took the ointment the first time. Well, we stop taking it, and then the rash comes back. We realize it's stable again, and then we introduce the IV or the ointment again, and we see the same effect. So we would call that a test and a retest. So we did it twice just to make sure that we're certain that independent variable has had an effect on our dependent variable. The ointment has had an effect on the rash, okay? And that's just one example. Now, when we say we want to use something like a quick-acting treatment, well, how does that apply in the world of human behavior? Medication-wise, I can completely see why we would want quick-acting treatment. But when we're talking about the criminal justice system, or we're talking about human behavior, we don't want to implement a new law if it's going to take 77 years for that law to have an effect. So, even in terms of policy, we do want to be able to introduce something and be able to see a change sooner rather than later, okay? So the quicker we can anticipate seeing a change between our time 1 and our time 2 observations of our dependent variable, the better. Now, it's often easier to detect an effect in 24 hours or within 1 month than it is in a period of 10 years, okay? And it also reduces the number of potential other variables that could have an effect on that dependent variable. So let me give you an example. Let's say that you have an upset stomach. At time 1, we say, oh yeah, on a scale of 1 to 10, my stomach upset is about an 8. And we continue watching you throughout the day. We're not doing anything until this point, and then we give you some medication, okay? And then we look at time 2, which would be the next day. How upset is your stomach the next day after you had medication? Oh, well, it's a 1 now. I feel much better. Okay, that's great. But say we looked at the same thing over a period of 3 months. Now, at time 1, you've got an 8 out of 10 upset stomach, but you go on, take some medication, and then we don't follow up with you until 3 months afterwards. Well, I'm going to anticipate that your stomach's going to feel a lot better 3 months after an initial stomach upset. Like, how can I be sure that it was the medication that I gave you and not something else, like time or rest or just getting over whatever it was that was making you upset? Okay? Same thing happens when we talk about policy. All right, so giving somebody a swift sanction can often reduce the risk that they'll repeat that crime if we do it swiftly rather than if we draw it out for a really long period of time, okay? Let me talk about an example here that we could easily collect and very simply collect to see if an independent variable has had an effect. If this is my research question, will the implementation of a neighborhood watch group affect the number of break-ins and thefts in a neighborhood? Then my hypothesis will be a statement, and this is how I think those variables are related. Implementing a neighborhood watch group will decrease the number and frequency of break-ins and thefts in our neighborhood. Okay, so I'm interested in the number of break-ins and thefts. All right, I want to see a change in those because I know a lot of them are happening right now, and I want to see them change in the future. Not go up, but go down. So what I'm planning on doing is introducing an independent variable. And in this case, it would be a neighborhood watch group. So I plan to talk to the neighbors and say, this is what our plan, this is what we're going to do. We're going to look at the number of break-ins that have happened over a period of 6 months. Then we do our neighborhood watch for 6 months, and we collect data on how many break-ins and thefts had happened over that period of time to see if the neighborhood watch had an effect on the dependent variable. So diagrammatically, it would look like this. At time 1, I'm seeing 57 break-ins over a 6-month period. Then I implement my neighborhood watch group, and we continue that over a period of 6 months. And I look at my dependent variable again, and I'm seeing the number 29. Now 29 compared to 57, that looks like a pretty big change. Now how can I be sure it was just due to the neighborhood watch rather than the weather or the number of residents? Well, this is where as a researcher, we have to think about those control variables, okay? And as the trimester goes on, we'll talk about more ways that as researchers, we can ensure that our results are valid and that they can be trusted. And some ways to do that are controlling extraneous variables. So in summary, the before and after, test, retest, pre and post test sounds like this. If we have questions where we can think about, I wonder what will happen if X. I wonder if there will be a change in Y. This is a perfect opportunity to use this methodology. It allows our dependent variable to be measured before and after an event happens. Okay? And by comparing those two measurements in time, we can be pretty certain that our dependent variable has changed. It is more accurate than the after the fact method, okay? Because we as researchers have control over something, the introduction of our independent variable. But again, it's not 100% accurate. It can be improved though. Some of these methods we've talked about here, especially having stable observations and quick acting treatments. So I hope that you've enjoyed this short lecture on the before and after method. The next one coming up will be on our control group methodology. Take notes, work through it yourself, and I want you to really think about when you're reading literature, can you identify these sorts of methods in what you're reading? All right, till next time.